Guys, in this video, let us look at the syllabus of psychiatry. Okay, the course content, subject content for MBBS. As you have already seen, psychiatry is coming under general medicine for you. So, under general medicine, you have general medicine, psychiatry, dermatology and TB chest. Okay. So, psychiatry, let us look at the content of this subject. So, the syllabus is such that you should be able to diagnose and treat common psychiatric disorders. You should be able to handle these emergencies, and you should refer to specialists if required. So, you look at the objectives. You should at least be able to recognize normal and abnormal behavior. Then, look at these terminologies: organic psychosis, functional psychosis, schizophrenia, affective disorders, neurotic disorders, personality disorders, psychophysiological disorders, drug and alcohol dependence, psychiatric disorders of childhood and adolescence. So you should be able to see the patient. In this case, maybe interview may not be possible, but interview the patient if possible. Or from others, you will get the history, right? Then you should be able to conduct clinical examination to assess the mental status. Look at the other 3 points here. So then you should be able to integrate. So integrate all this into what? With everything that else that you have studied: neuroanatomy, behavior, forensic also. Departmental objectives. Now we will enter the exact syllabus, okay? So this is the syllabus, guys. So, history, treatment of mental illness, concept of mental health versus mental illness, classification system currently which is used in psychiatry. What is the classification? So, there are a lot of classifications that you know, classification of different type of psychosis, etc. So, what else is there? Same thing, examining the status. Main things you should know. Look at these important terms: schizophrenia, mania. Mania you have like bipolar and all that, right? Then depression, anxiety disorders, hysteria, dementia, alcoholism, drug abuse. Psychiatric emergencies, you should be able to recognize and give initial therapy. You should be able to refer. Then childhood disorders, like disorders of childhood, adolescence. What comes here? In childhood, they talk about something. Attention deficit hyperactive syndrome. Lot of things are there, guys. Anyways, look at this: attention deficit hyperactive disorder, ADHD, for which the treatment they have given imipramine, nortriptyline, and a lot of atypical antidepressants, CNS stimulants. See, in pharmacology, you have already seen all these terminologies, right? Depression, anxiety, obsessive compulsive disorder, etc. So you have already studied all these also, antidepressants, the classification. Currently, what do they like? They like SSRI, SNRI. All these are preferred drugs, atypical antidepressants, etc. What they don't use is tricyclic antidepressants, though they are actually very powerful. If you remember, in pharmacology, you have already seen this difference between neurosis and psychosis, etc. Schizophrenia comes here. So if you remember antipsychotic drugs, you have haloperidol, risperidone, olanzapine, all these, chlorpromazine. So, drugs for bipolar disorder, they are talking about lithium. Alternates to lithium, you have sodium valproate, carbamazepine, antipsychotic drugs. So many drugs are there, benzodiazepines. How exactly schizophrenia you handle? Risperidone, olanzapine, right? Atypical antipsychotics are preferred, right? And if these don't work, then only they will give clozapine. In pharmacology, you have already seen how to treat chronic alcoholism. So, what are the drugs they are telling? First of all, they are doing counseling, rehabilitation, then disulfiram, then they are talking about naltrexone, then ondansetron, topiramate, etc. Benzodiazepine reduces alcohol withdrawal symptoms. Guys, we slightly got deviated into pharmacology. Let's go back to the syllabus. So, we were here, till here we finished. Then questionnaires in psychology, how you use. Intelligence tests, how you measure the intelligence, is it? Personality disorders. So all this you should know in psychiatry. So as an MBBS graduate, what do they expect from you? Psychiatric evaluation and recognize the psychiatric illness. common psychiatric illness at least. So did you get a introduction into psychiatry, what exactly is being expected out of you, what the syllabus is, what people do in this, the pharmacology, everything we have covered, right? So hope you have understood this. Welcome to Psychiatry. Enjoy it. Bye-bye.